and the Society for the Diversity of Equity and Inclusion in Business, Making Diversity Your Business event. The Society for Diversity, Equity, and Inclusion in Business is an organization that strives to build community through education, empowerment, and networking related to diversity, equity, and inclusion in business. To empower future leaders to celebrate diversity and engage in equitable and inclusive practices. My name is Camera Cobb, and I am a board member of SDEIB, and I welcome you to our Making Diversity Your Business event. For today's session, we will have a moderated conversation followed by audience Q&A. So as you listen to the conversation, please be thinking of questions for our guest speaker. I want to set some rules and norms and expectations for our event. First, please assume the best intentions of our guests and our moderators. Keep your camera on if possible. Kindly hold all questions until the latter portion of the session, where you'll be able to engage by asking your question aloud or typing in chat, whichever one makes you feel more comfortable. And please remain muted unless called upon during Q&A. Now I'll begin the introduction of our speakers. Dr. Dorsey Norwood is an Atlanta native who graduated from the Westminster School in Atlanta. She attended the University of Virginia, where she was pre-med and a studio art major. She returned to Atlanta for Emory University's pediatric residency, hoping to reconnect with her roots. At Emory, Dr. Norwood won Resident of the Year in 1999 and Pediatric Professor of the Year in 2015 to 2016. She then served as the Pediatric Department Chair at South Fulton Medical Center from 2006 to 2010. In her free time, Dr. Dorsey enjoys serving as a Reach Out and Read board member, Orange Theory Fitness, playing and coaching ultimate frisbee, surfing, and spending time with her cat, Mac. SDEIB founder Amy Smith will be our moderator for today's discussion. She's been an educator and innovator for the past 11 years, living and working all around the world, from Venezuela to China to Indonesia and back to the US. She has earned 2 master's and degrees related to mathematics education and is currently pursuing an MBA through GSU's Robinson College of Business. In February 2021, Amy founded and is acting director of the Society of Diversity, Equity, and Inclusion in Business, where she develops and implements programming related to DE&I through a lens of business. Smith is keen to break through barriers and find relatable and achievable ways for businesses to demonstrate growth in inclusivity and equity in meaningful ways. Smith lives in Decatur with her husband and 4 pets and looks forward to welcoming her first child this April. In her spare time, she loves hiking, gardening, photography, and ultimate frisbee. Please join me in welcoming our guest speaker, Dr. Norwood, and Amy Smith, moderator.
Thanks, Camera. Dorsey, welcome. So great to have you with us today.
I'm excited and nervous to be here.
It's going to be great. Hi, Mac. So let's dive right in. We're so excited to hear your story. This is our first event related to the health profession. So we know we have so much to learn about DE&I in that realm. What is your diversity story? What does diversity really mean to you? And I know you shared some images, so I'm going to go ahead and share those as well while you're speaking.
These are 2 long things. I feel like my diversity story has been evolving. And as I became more aware of the importance of diversity, I think I've been striving more to understand it and to include it in my workplace and my everyday life. Diversity to me is inviting people than myself, and people from other backgrounds or sexual orientations or ethnic backgrounds or racial backgrounds, inviting them to share their stories and celebrating the differences. I was born a pretty privileged kiddo in Atlanta in 1971. And at the time, it was very common to have a maid that would raise your children. And thank God I had Janie. Her name's Janie Glenn, or was. It's interesting. Her mother worked for a family about 3 doors down, and then some of her other sisters worked for the rest of the families on the street. And so if you really want to know what was going on in Buckhead, all you had to do is talk to the Glenn family, because they knew. Janie is from like the East Lake area. She was there the minute I got home from Piedmont Hospital, and she has been my source of universal and accepting love since then. I think growing up, Janie just, she was my mom in many ways. She taught me the difference between good and bad. She definitely had the authority to make me go pick out my own switch sometimes, which not every white family did, but I appreciate her now for that, because I got to learn how other areas of town, like what was common in raising the children. She liked me better than my sister though, so I never really got the hard whipping. It was always my sister. She would be like, ha ha, I didn't care. And so that's a whole different story. But Janie was there for me. I'm not really sure what my mom was doing. She was off at the junior league or something. I also through her learned true Southern cooking, and I got to hear her on the phone talking to her children and dealing with her life, social issues that were going on when I was at home. When my mom got remarried to my godfather, that's a different story, but we moved in 1979 to North Carolina for a few years. And again, I actually appreciate that severance from my alpha from being at this private school, because it let me realize there's a whole different world out there, which I think a lot of people in my high school didn't know. This is the picture on the slide. It's kind of a retrospective thing. In the last 5 years, there was this book that came out. In college, I took a lot of civil rights history classes and about the movement. And there was a lot focused on desegregating public schools. But recently this book came out, and it was interesting. I never thought about desegregating the private schools, and one of which there's Andover. There are about 4 or 5 different very elite private schools, and my school was part of that book. And so I got to come back. Again, I can't remember what it is. The older I can't remember how long ago things are, but I got to hear the first 7 kids that were admitted to Westminster, and their trials, but also the good things they got out of it. I remember one woman, I guess this helped me understand systemic racism also. She said she went to Westminster because she was from the Cascade area, and this was the best education in Atlanta, and she wasn't there to make friends. She was surprised when she did. It was a boarding school at the time, but something I hadn't even thought about is because she went to this elite school, she was able to have connections that other people from her neighborhood didn't have. She was able to go to Harvard because Westminster had this, reputation of producing high quality students. And she was like, nobody would ever accept a kid from Tri-Cities, to Harvard. And the other thing that was interesting to me is she said, because I had those experiences, when she became a CEO of a company and the room was full of white people, she was like, I was comfortable because I grew up going to a mostly white school. It was just a whole different, it was a whole different viewpoint for me. I never thought about, that's a different part of the systemic racism, right? Like the connections that you have that you're not allotted by the constraints of society.
Absolutely. And I know with your relationship with Janie as well, right? It was not only getting a sense of care, but also a sense of a different lifestyle. But you were also exposed to challenges that may not have been faced in your own community.
Yeah,
right?
I think one of the first things, I know the big one I'm going to talk about, but one of the first experiences I had with Janie, I must have been 8 years old, but I found her crying on the back steps because she didn't have any money to buy her kids anything for Christmas. And I think then I realized how privileged I was. I went around and I got a silver dollar for her older son, and like a bat and a wiffle ball from, like, these were things I had around the house for her younger son, and some other things for her little kids. And I left them on the dining room table for her, so she could have them for the kids. And she appreciated it, and she took it and she gave it to them because at least she could have something to give to them.
Yeah.
So yeah, I get teary-eyed thinking about Janie. So, but the big thing is when I moved, right when I was moving to Chapel Hill, Janie, who's right here, I am going to get teary-eyed. She every month would, back when you had to pay for long distance, with her lack of income, would find one time a month to call and check on our babies, me and my sister. And just talk and say, hey, baby, I love you and I'm thinking of you. Well, during this time, there were the Atlanta child murders from 79 to 82, I believe. And one of her sons was killed. So that's her in her older age before she died, going to his gravesite with this picture. And that picture can be seen here in the Time magazine recent workup about Billy Starr. His other name was William Barrett, but she called him Billy Starr. And I recently, they also have a new, well, now it's an old podcast about Atlanta Monster. And the first episode, they read out the victims of these kids, and his name was on there, and it just was like a gut punch. There's pictures of Janie at his funeral. And the hard part is I was in Chapel Hill at the time, but I tried to talk to her through that time. But it also, again, was eye-opening because all of these kids were killed and it didn't seem like the police were doing anything. So the inequities, again, it's not like I'm suddenly woke or something. I feel like I'm always learning about the system and about the inequities, and just her lack of, she didn't have a good law representation. Just her experience with that was it was devastating for, of course, her and her family, but to me, and, he'd been in our house plenty. So that, to me, I felt a connection with Janie. And when I moved back to Atlanta, I had another experience that I didn't tell you about, but She was raising her grandchildren, as many people on the South Side do. And one of her grandchildren was acting out aggressively and sexually. And I'm sorry, close your ears if this is too much for some people, but with her 8th grade education, because she quit school in 8th grade to help her mom out, knew that this kid wasn't a bad kid. Like, she knew she may not have been book smart, but she is emotionally smart. And she knew there was that kid just wouldn't do that without any reason. So without her lack of funding and having to go through the Grady system, she took him to a psychiatrist, and it found out he had been sexually abused, held down by his own mother, while someone else had sexually abused him. So Janie called her daughter and said, and I think this is the bravest moment. This is the bravest thing I've ever thought of, is she called her own daughter and said, listen, I know what happened. You have 24 hours to get your shit together, and I'm sending you into jail. So to be the protector of children, most families ignore that kind of stuff. I know my mom ignored it when I told her something happened. And Janie, without the resources, stuck up for this other boy and got him help that he needed. But it wasn't easy for her.
Yeah.
But that taught me a deep lesson that it's not like people are inherently bad. There are bad systems that set them up for bad things to happen. And so that is part of what drew me to pediatrics, and also pediatrics in an area that's not well served. I mean, like a better term. I finished Emory, and my dad has a pediatric office that's pretty prominent, all self-pay in Buckhead. And I was there for 2 years. And although I learned a lot working with my father, it was not what gave me fulfillment. I remember a friend of mine asked me, she said, do you remember how happy you were when you were working at Grady? And I really was. I mean, residency is supposed to be miserable, but I felt like I could really connect to the patients. And I'm going to tell this terrible story, but it proves that you have to respect other people's dialects and other people's customs, and not, so I felt like I was the English to English translator for some of the northern kids that went to Emory. And this kid came into the ER having a seizure, and the guy from Connecticut couldn't seem to get any answers out of the mom. And I said, has this happened before? Yes. And I was like, are you on any medicines? And she said, peanut butter balls. And I was like, oh yeah, phenobarbital. Like, not in a judgmental way, but if you don't know the language, medicine is a whole different language
in and of itself, regardless.
In of itself. And so if you don't make fun of that, you like, that is the best way she can remember it, right? It's like, I've tried to learn words in Vietnamese, and good Lord, I am horrible. I mean, I've tried to look, because I do have Vietnamese patients. So I at least get thank you and congratulations for when I got to see their new babies and Kamang, which is, thank you. By the way, I just killed it. I mean, different accents at all. But for me, I had to remember that as come on, like, come on. And even if I had to say it 6 different ways with 6 different inflections, the Vietnamese population really appreciated that when I can say it in the room or when I saw their newborn baby. Or even, there are a lot of, where I work now in South Fulton, there are a lot of Nigerian doctors and nurses. So I feel like it's paying homage to different cultures by at least being able to say thank you and please. Yeah. So I see there are a lot of, there used to be a lot of Nigerian people that would come deliver here and then go back to Nigeria. but I learned, oh God, I'm going to mess it up. I think it's Igbo, but by saying kadu, which is like, what's up? Their eyes would open. They're like, Adame. So they like, sometimes I got it wrong. That they're like, that's Yoruba, whatever. But the mere effort to learn something, I feel, makes people feel more comfortable.
Absolutely.
I
Oh, sorry, go ahead.
no, God, I can keep talking, so hit it.
Well, I was just going to say, I love, learning. Your father was a pediatrician practicing, and that was perhaps your window into that world. But then to see your sort of evolution, right, into this population that really just called to you, right, and that you knew that you could serve, you knew that you had ways to connect with and relate to, and you've worked for it, right? It has not come naturally, and that's a lot of dedication. So if we step back from your personal story a little bit, can you tell us more generally what diversity, equity, and inclusion looks like in healthcare in general?
Yes, at least for my office, I want it to mean that everyone is welcome here. And I mean, I put that, there's an ultimate sticker that says that, and I put it on the front door. And I mean, everybody. I have Black, white, poor, rich. There's a private school down the street from me. They come. And so that's a whole different thing. But I think it's just as important for the white kids to be exposed to different caregivers, right? And see them in positions of power. I'm sorry, I forgot what you asked, but what is it in medicine?
Well,
Ooh.
so because I know some of the challenges that I'm aware of have to do with, valuation of reported pain, right? There's been all kinds of historical mistreatments of people of color by the healthcare system. And so there's a lot of challenges with trust. And those are things that, don't just turn away one day, right? Those are systems, those are ingrained, and those are traumatic experiences. And so, as a practitioner, especially as a white practitioner, where have you found your place in that, and kind of how have you tried to move forward and not make amends, but establish your practices to avoid those same challenges?
So when I left Dad's practice, I joined an OBGYN practice in East Atlanta, which is diverse. And I mean, it's got, like I said, rich, poor, Black, white. There's a large Mexican American community there. There's some Vietnamese. There are some small higher socioeconomic areas right around Woodward. So like Egan Park, and there's Jefferson Park. So I feel like, and I feel like I've been there for 18 years, earning trust. I see 3 different generations of families. My favorite story is, sorry to use their names, but I have a family of 6 Kent sisters, and I see all their children, all their cousins, some of their children's children now. And so I am a comedian, that's funny, a community physician, right? And there's a group of Fonsecas, and we laugh that you're either married to a Fonseca or you are a Fonseca. Like, there's a whole group of Spanish speaking people there. So I really feel like I've been, just by my being there and being consistently there and listening to stories. Sometimes moms come in and they just want me to listen.
Yeah.
And by not interrupting and by listening and making them feel like they've been heard, I think that's what's earned trust there. I mean, I've been to I'm getting teary-eyed. I've been to, unfortunately, 3 different funerals this year of moms that have died from COVID. And I may have been the only white person in the church, but that didn't, I mean, actually that made me feel proud. Like a community that I shouldn't be trusted in has invited me in. And yeah, they don't get a lot of people to trust around there. One mom told me that white people will turn on you. And so that hit me hard. And that's something I could hear coming out of Janie's mouth. Oh, by the way, Janie died in 2012. And this was another lesson for me. She was at Piedmont Hospital with her whole extended family, and none of the doctors explained to them in a way that they would understand. And I don't mean simplistic. I mean, don't use medical terms that, people with masters and PhDs don't understand. Just
Absolutely.
talk to individuals are individuals. And so you have to figure out what, meet on a level where we are interacting and understanding each other.
Especially
and I think
in a
it's the
time like
doctor's responsibility to explain that.
yeah.
So she was dying of adenocarcinoma. It was in her neck, all in her lungs. And they just didn't understand the severity of what was going on. Like, she had days to live.
Yeah.
By the time she got help, because she'd gone to Grady 2 or 3 times, and I don't know if Janie didn't tell me what was going on or whether she just didn't understand. But I became the mediator between Piedmont Hospital and her family. So they said, oh, we don't want her to get addicted to morphine. We want her to go to another hospital and get treatment. I mean, honestly, I said, I want her to get nice and addicted to morphine.
Yeah.
Because she is in so much pain right now, and she's got to be able to pass on in a happy place. Sit next to her, read Bible verses to her, do things that will make her feel comfortable.
Yeah.
It's not like I'm that religious, but I know that to Janie, that's religious. I mean, she's very, once she stopped clubbing and stuff and taking care of her children, she very much found solace in her religion. And so I try to respect that, and a lot of parents bring their kids to explain to me what the hell the specialists say.
Yeah.
I also try to earn their trust by listening to what their complaints are and getting them access to speech therapy, occupational therapy. On average, I think children of color get diagnosed with autism by the time they're 4 or 5, whereas non-Hispanic white children get help when they're about 18 months.
Wow.
So I have to help parents understand that he ain't going to grow out of this one. And no matter what it's called, we need to get him help right now. And I know your family's giving you a hard time about it.
Yeah.
But you and I are going to work together.
Right.
And it's the same. It's the same what I learned from Janie. If there's a boy who's getting kicked out of preschool, which is ridiculous, or middle school because he's acting up, instead of labeling him a bad Black kid, why don't you figure out what's going on? Like,
Right.
What's going on at home? How can you provide services? Quit calling his mom to come pick him up every day, so then she misses work and misses the rent, right?
Yeah.
So there's a lot of extra work I do to try to fill out forms for school, and get them connected to services that are near them, or at least on a bus system.
So, and this ties nicely actually into our next question. You've kind of tackled the latter part before the first, but you've been really talking about things that you do as a practitioner, right? Like the values that you hold and what you deem most important for your patients, right, and their families. And a lot of that has tied in with your sensitivities to equity, right, and inclusion in healthcare. My other part of this question, and as I do this, I know you shared a bunch of pictures that you wanted to share with our viewers, so I'll just kind of slowly flip through these as you answer. But I'm wondering if you can break down for us what's happening for you currently professionally and what are your future plans, right?
God. Okay, first of all, there's other ways of making people trust you and feel included. And one is I encourage them to make pictures and I hang them up in the rooms. Like that's from 2016. This girl is a grown woman now, but she made me a picture, and so I hung it up. And I have show and tell. Can they see me right now?
But yes.
Okay.
Just small, but actually,
Like,
hang on.
This is my favorite. Can you see it?
We're gonna make you bigger. There we go.
Okay. I even framed it because this is my patient, Roderick. And this is me. And he also explained that this was dirt and grass, just to let you know.
Got it.
But I love that I have a stethoscope. I got my ponytails, which is interesting. But we're the same color. And he's also on the same level as I am. And that makes me feel like, damn, maybe I'm reaching some kids that, don't have people they can trust.
Yeah.
That was my first one.
Oh,
And then the other one is other things, when people come from different countries, they often bring me back things like this is from Vietnam. And I like to make the office reflect my patients. So I'll hang that in the room. It's hard to hang these shoes from Pakistan. Look how beautiful they are, though.
Wow.
They must think I have size 4 feet, however. We're from Kenya. We're from Ghana. I'm not done.
Because you're so loved, Dr. Norwood.
From India. So, but having these things available on the walls makes people feel more comfortable. Mexico. And also on that page was a picture of a program called Reach Out and Read, which was started when I was in residency at Emory. And it was a research project in promoting literacy in children and what the effect of the nurse giving out a book at well checks versus the doctor, and having a waiting room that was encouraging reading, being reading friendly. We have books in the rooms, we have books in the waiting rooms, but we also make sure that we get books that reflect my patients. Like this is an awesome one. This is from an artist in Atlanta, and he has lots of different ones, but this is about the West End, which is pretty cool.
Yeah.
So they look in there and read about people in the West End. This one is just Barefoot Book of Children. It's about from all different parts of the world. So it's, I like to reflect on the inside. It's not just a bland place to come. If they can see what they brought me on the wall or what other people, then maybe they can feel more comfortable. I also like it to be comfortable for children of same-sex couples. I am gay, but I don't think that's what brings them there. There gets to be blogs. God, I can talk forever, Amy. So hold on. But one thing I thought was interesting when I first worked at my dad's office, it's not like I tell everybody I'm gay, who cares, I'm taking care of your children. But it came up in a conversation with this young couple. And this is what makes me cry. This is what parents should be doing, no matter who your children are. It came up that I was gay. And I was like, to the straight couple, I said, is this okay with you? Because I am taking care of your child. And, there's a lot of stereotypes about gay people and children. And they said, oh, no. This is why we picked you. We figured if he's straight, we got that covered. But if he's gay, we want him to have someone to talk to.
Oh.
I cried on that one. So I know I'm running out of time. What's going on right now has been quite devastating. The owner of the practice was actually, I opened as an OBGYN pediatric practice to serve the community because it's hard to go off a day for yourself and a day for your kids' checkups. And if you're on the bus, it's one-stop shopping. So one side would be OB and one side would be pediatrics. Well, out of the blue, the owner decided she's lost her mind and it was going to sell the pediatric practice to a company. And they came in, I have a satellite office in Decatur. They've already bought that practice, didn't tell any of my patients. And at the current practice, they've decided they're not taking over it. It's not their, I don't know, it's not their community. It was a gut punch. I interviewed at a lot of different places that I admire, some in East Atlanta, some on the north side of town. But I mean, I was crying every day because I just felt like an emptiness. I'd done that before. I'm a pediatrician. If I wanted to be rich, I'd be a cardiothoracic surgeon or something. I mean, I'm fine.
How long have you been practicing in East Point?
18 years. So I know people's grandmothers. I know their great grandmothers. So what's going to happen is as of April 1st, she's closing down Life Cycle Pediatrics, which I think is, that's how you treat your loyal customers and your loyal providers for 18 years. I feel like the pandemic has really brought out people's colors, like they're true who they are. So I can't leave. This is where I find joy, even though the social situations are difficult. I go to a shrink every Wednesday. I have to work through these things. It brings up childhood trauma for me. We're going to open our own practice called the Life Cycle Pediatrics right down the street.
Woohoo!
And I'm bringing one of the pediatric nurse practitioners with me who has a master's in informatics, which I didn't even know what that meant. I had to go look it up. But so she's going to help me, because I've been in this bubble, update all our EMR systems, and which can make everything
Medical records, right?
Yeah, I'm sorry. Yeah, medical health records. So a lot of frustration was with dealing with my front desk, but with these new electronic medical records, they can check in online, they can make their own appointments, they can ask for refills. So it's going to be, I'm hoping, if I can get through this, more time for me with the patients and less doing paperwork. I love these pictures. Okay, so every year I dress up for Halloween.
It's epic, everybody. It's
my best one was Charlie and Willy Wonka.
Willy Wonka, yeah.
Because unfortunately I look like Gene Hackman, but not Gene Hackman. What's his name? Anyway, I was the woman from
Hunger Games.
Hunger Games, which is funny because all I had to do is go into my mom's closet, because she's from Buckhead, and just pick out some clothes from her. But my patients make appointments on Halloween so they can see what I am that year. And this was just a fun picture because this was the day that there was the solar eclipse.
Oh, okay.
And so I stopped everybody it's like I get to teach everybody on everything. I stopped everyone from doing what they're doing. I had some old x-ray material, like from my shoulder when I broke it, and cut it up into little pieces because that can work too. And all my patients, my lab tech, my co-workers, we all went outside and watched it. Cool. And it's like I got to teach science to these people who would have never even thought about it, right? And this was also a great time. At one time, I was so proud of our office because Kim Malone is here. She's a Vietnamese boat person. We had a doctor that escaped Rwanda before the genocide. we have people, we have all sorts. We have people with stories that we are want to hear and we welcome. It's funny, sometimes I even use my own students. I have one, she was from Nigeria, but she, I mean, her dad was, she went to school in the United States. So, but sometimes some people from Nigeria would not really, I could tell they were standoffish for me. And I was like, have you met Tosin? And she'd come in, and it's the funniest thing. She thought it was funny too, but she'd say, everybody has different dialects, but they have the same kind of English accent. So she would come in and be like, what village are you from? And then they're like, oh, and then they would open up and feel comfortable. And it's the same thing with, you know, I've had people from all sorts of countries. And if I can show that I appreciate that and I'm trying to make an effort, it makes a huge difference. I got one more story. Like, I have a transgender child who is male to female, and he's raised by 2 white women, and he is, I don't think he's biracial, but he's African American. And I didn't even ask him, but his hair was a hot mess. So I asked Sheena, who is Black, to go talk to him for like 10 minutes about hair care, which is super, super important. And the kid left like a little weepy-eyed because nobody had told him, I'm sorry, I'm now using the wrong pronoun. Nobody had told her how important it was and what to do. And so anyway, I try to recognize the differences and meet people where they are.
And I think we just witnessed a very real part of being a person that absorbs DE&I and takes it into heart. It doesn't mean that you're flawless and that you're suddenly aware of every single sensitivity and that you're going to always get it right. But it does mean taking a breath, correcting yourself, and owning it, right? And so whether it's pronouns, whether it's other
Which you taught me last week, and I must have to tell you, it helped me. Because I have a Mexican-American kid that is female to male. And I noticed, because I speak some Spanish, that his mom kept saying ella. And I was like, why doesn't she call you him?
Yeah.
So one, that was to pick that up and to ask him, you taught me this. And I taught my nurse practitioners to ask, what are your pronouns? Not what are your preferred pronouns? And that was, that's a new thought to me.
Yeah.
But by bringing that into the office, you know, that nurse practitioner is pretty conservative. She's the one that I've been bugging for 16 years, because like, if a boy wants a princess sticker, I kind of lose my mind when the mom said, that's a girl sticker. And I'm like, no, you don't want your boy to appreciate a gorgeous looking girl, right? Like, I turn it around on them. Oh, you don't like him you want him to want a boy sticker? And then they just, like, it confuses them, so they can at least think about it, right?
Yeah.
But I feel like it's important at my office is keeping conversations going. Even yesterday, I have a new MA who's African American from the system, and we were talking about how there are different kinds of Latinx people, and some get offended when you say Hispanic, and some get offended when you said Latino. And I was teaching her how there are different types of Spanish speaking people. And I said, just like there are different kinds of Black Americans, you know?
Yeah.
And then I said, just like there are different kinds of white people. She literally said there are. So I was like, yeah, I mean, I know we look alike, but, you know, there are English, there are Italian, there are Crimean, there are, like, you know, each individual is an individual.
Well, Dorsey, needless to say, I could pick your brain and talk to you all day. We've done it before. But I want to hop back up here.
Okay.
You did share a multitude of resources. with our audience, and everybody who's viewing, you're going to get these in a follow-up email from us. So you'll have access to this slideshow that we are showing. So I know that there were a number of titles here. Dorsey, I don't know if there's just maybe one or two that you want to highlight, and then
I mean, I can highlight them quickly. The first one I read in medical school, The Spirit Catches You and You Fall Down. And it was it demonstrates the collision between culture and Western medicine. And in this book, this child has seizures, which in that culture, means he has been chosen by the gods to have special powers. And coming as migrants to the United States, they had social work involved, trying to take them away because of medical neglect. And so it just showed the importance of trying to understand why patients are doing what they're doing, not because they're bad patients or bad people, or you can't judge people just from where they come. There's a reason why they do what they do. I'm Chocolate, You're Vanilla was another one I read. I mean, I'm not saying it's a like keep awake at night reading, but it was a fascinating research done by a PhD woman at Harvard, just about how race is taught within Black families, and when children develop that awareness that they're different colors or different races. Remember that movie, Losing Isaiah? Does anyone remember that? Halle Berry. There's a beautiful spot where the adopted Black child puts his hand in the white sister's hand, and then the white sister says, what's the difference between our hands? And he goes, yours is bigger. So it's like how we're taught that, and even within Black families, about good hair and bad hair and light skin. And but it's interesting that it goes through the different developmental stages. So this was just a book I read a couple of years ago, just about his journey becoming a doctor, and knowing the research that's done that's trying to prove the differences between Black and white communities, when they're not looking at the difference between the poverty between the races, and also he was often asked to represent all Black physicians, and I just wanted to see what his journey was like.
Yeah.
And then this I listened to when I got furloughed during COVID. I'm not saying it's the most uplifting book in the world, but I would go for a walk and listen to this. And I just think it's a fascinating book. Maybe take a little at a time, because it hits deep. Just how race is a construct, and when it came from, and why. And and he goes back to the 1500s. So it's I really enjoyed that book.
Great. Well, thank you for sharing those. Like I said, for our audience, you'll have access to all those titles in the slideshow. So at this point, in our final 10 minutes together, I'd really love to.
Already 10 minutes.
I know, because you're a rock star and time flew by. So we have some time for questions for Dr. Norwood. You have two ways of communicating these. One, feel free to send them through the chat and I can echo them. Or we also encourage you to use the raise hand feature in Zoom. And will be happy to allow you to chat directly with Dr. Norwood. And on that note, I think we have our first question already. So I will invite Treasure to share her question.
Okay.
Hi there, Dr. Norwood. Thank you so much. Love the conversation. I took a bunch of notes, and I wanted to just ask, I'm from a little town in Alabama. And so I see a lot of the, kind of access to healthcare, and I'd say lack of rather. So are you able to speak a little bit to what we as a society, I don't know if it's, you know, at a, I'd say government level, can do to help with the lack of access to healthcare in those communities?
It's a gigantic problem. If you're born in Atlanta and have sickle cell disease, there's the Affleck Center right there, and the best trained hematologist in the world. If you're in Hayhire, Georgia, or Dothan, Alabama, those doctors may not have been familiar with treating children with sickle cell, or now adults, because we've become so affected at treating it. I mean, I had a kid with sickle cell who had a kid. That was never heard of 20 years ago. Yeah, access is devastatingly hard. I think one thing that has helped during the COVID is like Zoom meetings. Nothing replaces in-person visitation with, like for me, I could never do a Zoom well child check. What I watch is the interaction between the child and the mom. So using technology, I think is going to help in the future. But also making, but also making those smaller regional hospitals aware that that's an important resource to use. I even learned this in my own practice by training at Grady and Hugh Spalding. I had an entire floor of sickle cell kids. And I had another doctor come in who was, I don't know where she was from, Midwest, but she hadn't had a lot of exposure to that. And the panic in her, it was such a like secondhand thing for me. Like, this is when you need to go to the hospital. He needs to be hydrated. He needs to. So I think we need to reach out to more regional doctors and tell them what's available. I don't know why I'm on sickle cell, but luckily that's become a part of the newborn screen. Before you leave the hospital, in most states, there are at least 8 to 9 different state metabolic screens that are sent to the state lab to check for. And in my practice time, only in the last 20, 25 years have they made cystic fibrosis and sickle cell disease part of it. And so hopefully that will help maybe people with less access aware of these diseases. And talking about things like transportation, oh my gosh, it's difficult. Even, I mean, I work in East Point, and I had a 16-year-old that was trying to get some help from me. It took her 2 hours on buses to get to me. So it's not just out in the country, it's even public access, and Atlanta's the worst. Medicaid does have Medicaid transportation. So on the back of their card, they can call, they need at least 3 days warning, and they can go pick up you. You have to have your card, your child's car seat, and they can bring you to the doctor, but they're not always very reliable, which I have to trust. I have to keep training my front desk. Like, my mom sucked getting me to doctor's appointments on time for anything. How can I trust a mom who's trying her hardest and she has to wait on the Medicaid transportation? Am I answering your question? No, it's a horrible problem. I think that's why sometimes if you go outside of larger cities, they are trying, you can make a lot more money because they're trying to recruit people with more training to serve smaller communities, so that they may not know the most recent treatment for sickle cell or cystic fibrosis, but they can at least recognize it. and refer them to the proper people. Did that answer your question?
I think it just reconfirmed that it's a challenge, right? But no, I'll definitely take that in. Thank you.
Was there something else you were referring to?
No. That I like that you are kind of confirming it though, right? Because it's not just me as an outside person looking in. You're in healthcare and you're also experiencing that. So no, I like that. Thank you.
You're welcome.
See, I do have another question here, and it looks like it might be the final one, and we'll invite any other questions folks have, you can email, and we'll be able to get those to Dorsey as well. But to wrap us up here, what's your proudest moment that you've had along your own personal journey, personal and professional, with diversity, equity, and inclusion? What's your
my proudest moment? I swear I could think of this last night. Yeah, this is not the one I was thinking of last night, but what I quoted you before, which is heartbreaking, because I had that mom with 2 kids with special needs and genetic issues, and she says white people will turn on you, and we usually don't trust white doctors. And she's been with me now for 12 years. Is that my proudest? I don't know if that's my proudest. I try to educate people, whether they are white, Black, Hispanic, gender fluid, and I try to educate my staff as well. And so when I have people have that aha moment, even like that experience yesterday, making the little waves can eventually come together to make a tsunami, I hope.
Yeah. Well, I want to call out, you got a shout out in the chat, Dorsey. It says Rachel Preston here. Just want to say hi, Dr. Norwood, and that I'm so happy you're continuing Life Cycle Peds. Thanks for all you do for the community. Oh. Well, on that note, I'm just going to share some closing comments here. First things first, for our audience, y'all, if you are not part of our networks, please do feel free to join. If you scan this QR code with your phone, that'll get you to our link tree to access all these resources. Following the event, as I said, you'll receive a follow-up email in which you will get a copy of our slideshow. You will also get access to the recording via our YouTube channel. So you can rewatch and soak it all in. Lots of little gems in this session today. Lastly, we invite you to register for our next event coming up in a couple of weeks on March 23rd. We will be hosting Kyra Bodrick of Refuge Coffee. And so hearing about her own professional journey and how she's now invested in that Clarkston community. Dr. Norwood, thank you so much for joining us. I can't wait to bring my baby to you. And I know that she will be so well looked after. I think I knew when I had the idea for this series that you had to be part of it, because I know you personally, and I'm a little bit biased in that way, but I want my kid to go to someone who cares about everybody in the community, right? And that's really important. So thank you for being that person.
Well, thank you for that honor. Yeah, thank you. I was surprised, and I'm now I have a lot more energy, because now I remember why I'm doing what I'm doing, and setting up a new practice in this area. I'm kind of tired because I'm closing out the old office and starting up the new one. And it takes little reminders that I do love what I do, despite all the ups and downs.
Well, we appreciate you. Thank you so much, Dr. Norwood. Thanks everyone for joining us. See you next
Thank you,
time.
guys. All right.
Have a good one.
Bye.
Bye.